Thank you for the organizers inviting me and giving me an opportunity to share with you a bit about how pricing works in Canada. While Michelle works on one side of it, my role is, and you'll see the theme of balance coming back, to balance the needs across various stakeholders. So the disclaimer, these are my opinions, not necessarily those of my company or RX&D, and I certainly will share with you sort of my experience over the last 15 years in this area. What I can tell you is when I started in this area, my life was simple. I was enjoying that there were one price for all customers. The word product listing agreements hadn't been created yet. We had limited tenders, mostly at the hospital level, that were really creating a very stable environment for pricing. And if Michelle would look back to her reporting, it would reflect that. And there was very limited price referencing. So now put a big X through this slide because life has changed for all of us. So how does pharmaceutical pricing work within Canada? And we heard Diane refer to the parent company. And the parent company in pricing is a huge aspect. I can honestly say that there's nobody in this room, unless you're a global CEO, that makes a pricing decision in Canada. We all make pricing recommendations, we make strong business cases, we endorse, we beg, we plead, but we don't make a decision. Pricing is not a local decision anymore and probably hasn't been so for quite some time. And that parent company needs to be convinced that my PLA with Diane is the right thing to do. So turning it around in 2 or 3 days is probably not a likely scenario, and we've been pretty upfront about that. But that parent company will ask a lot of detailed questions, and reasonably so. Then there's Michelle at the Patented Medicine Prices Review Board. She gives me some guidance on my price ceiling that plays one factor in a very multifactorial decision of what a price will be in the country. There are few companies that will just take, let's run with the ceiling and hope for the best. It has to be a strategy to be successful in a complex market like Canada. And finally, there's a payer who's looking for value for money, who defines price and value differently, and that little lady in the middle is me. I am trying to figure out, to find a balance between all of them, and to be honest, how I will describe success in my role is to keep all of them moderately dissatisfied. I will not be able to do a great job for any of them. If Diane walks home skipping, I know my boss is going to yell at me. If Michelle is really grumpy at me, I know I've gone too far. If my payer is coming to the table with an idea that I can respond to, and my parent company sees the light at the end of the tunnel, and I can make it work within the PIB, I know by the end of the day I've done a good job. It is not necessarily a fun job all the time, and I've been called some very interesting names, such as the Sales Prevention Department. And as such, I would say that the questions you ask yourself, and that are asked within the walls of any company, are very, very important to consider in this aspect. It is not, I always say it is not impossible to find an answer, as long as we sometimes all slow down, step away from what really is our ego, and say, what is the best that we can do here, and have some very honest conversations. So this is how pricing works, and quite honestly, it is fun, it is exciting, it is a bit crazy, very unpredictable, but it certainly is a challenge that every industry member faces, every payer faces, and as Michelle just said, the PIB is trying to figure out how that all works in their context. So Canada is a complex market. So when I say I have to deal with a head office globally, I have to explain to them how Canada works. And most of them kind of go, okay, let's do this again. Because Canada, for a market that is rather small, is very, very complicated. So on the national side, Michelle and her team set the price ceiling. Once you get them through that, then you have to move on to P-Coder and CDR and figure out how that works. And Well, doesn't that get you access? No, 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 that's just a recommendation at this point. Then you look at the PWGSC, who plays a role federally on contracting for certain products, particularly vaccines. Once you've sort of cleared up the national hurdle, you move on to the provinces. So you get one thing for the whole country? No, no, not really. There's really 12 or 14, sometimes 6, but every province does their own thing. And while we do have now a means to have discussions on sort of the concept and idea of what this looks like for a listing in a pan-Canadian forum, in the end, I can tell you, I am sitting down with every individual manager and team to say in the end that I need to have one contract for BC, one contract for Ontario. So the effort that exists at the provincial level is certainly mirrored on our side. We have 40 private payers. We have differential pricing for various reasons. Some are legislated due to differential price increase rules. Sometimes with Quebec you end up with a lower public price. But managing that gets fairly complicated. Pharmacist practices are different and differently regulated by each province, and public health programs are different. So all of that now, you walk them through, and they kind of go, gee, we're doing all of that for 2 or 3% of our global revenue. So the business case of putting in the effort to make sure that we are able to drive Canadian interests with bringing new drugs to market need to get balanced against explaining why is it worthwhile to invest in all of these things within the Canadian market. International price referencing, and this chart, I did not create it, I actually stole it from the WHO website, is from a meeting that took place in 2001. Since then, you'd probably add a couple more lines to that chart. And it really is why confidential pricing in one market is so essential. I call it the butterfly effect. If I change a visible price in Canada, I could potentially affect the price in Brazil, in Mexico, in Taiwan, in South Korea, and South Africa. And if you add up all that population in those markets, 34 million Canadians really don't have a chance to make a really strong business case in terms of the model that it affects. That's why the fundamental aspect of a confidential pricing is seen across Europe, why the Germans with the AMNOG reform are currently certainly struggling with that idea and the level of transparency, and why the financial implication of moving towards a very broad and transparent pricing system that references other markets, and you reference other markets, as we've done for the last 25 years within PMPIB, is something that needs to be understood from all parties. And this is often, while it is in the public domain, if you Google it, you'll find a ton of information, lots of academic data, but it is very poorly understood. It is a very complex science that goes on. And you need to be clear on what that means from a sheer business perspective as well. And companies have put in place, usually in their corporate head office, teams whose sole job it is to figure out how price referencing works and where the rules change, because what is good for 1 month and all of a sudden, oh, China introduced a price referencing scheme. They haven't done yet, but they're certainly talking about it. And if Canada is on that reference list, you can certainly imagine what that means in the discussions and the rationale and the assessments that will take place. Which puts me to another topic, and that's often asked, so how do you figure out where a product goes first? Well, it's tied to price referencing, it's tied to market opportunities. But this is a chart not from AstraZeneca, but a company called Cutting Edge Information that just published this. It is from 2011 data, so pre-AMNOG, and you can see that in companies generally, and this is not a great trade secret, divide launches of new products in wave 1, wave 2, wave 3 markets. So the first set of markets, the second set, it has to do with regular filing regulations, regulatory referencing, and all kinds of fairly complex issues that thankfully I don't deal with. But the US is generally always one of the first to see. Germany was as well, because it didn't have free pricing and would introduce at a very high price. But then you see the trend sort of whittles down fairly quickly. Japan is often on the bottom, but not necessarily for price referencing issues, but much more so for the very unique regulatory system that they have in Japan. And markets like Australia and New Zealand are, according to them and that data, almost never seeing a product first to market. They're often wave 2 or 3, so much more later introduction of new brands into the marketplace. And these are discussions that, I mean, are real. They are taking place in head offices, they're taking place in local offices, and I think it sort of talks about the interconnectivity of pricing well beyond, is it $1, is it $2, is it $10? And is it a confidential or a public price? Those are all connected to all of this. So the big question of what do we do going forward, I think it boils down to some very big basics. This is not rocket science that's on this slide, but there has to be an element of trust and dialogue between all stakeholders and a presumption of some good intent. We are all recognized that we're not all going to see and define value in the same way. We all recognize that we're not going to be always on the same page. But without some recognition that to move things along, that there has to be some trust and dialogue, we're going to tread water and get tired pretty quickly. Recognize differences. We are not the same. We have not the same masters. We have not the same objectives. But there is a middle ground. We just have to be open enough to see it. And if you get indoctrinated, you will never see that. We have to recognize that this is complex, this is not easy, and this is a challenging situation. Trying to make it oversimplify creates often a lot of unintended consequences. Things are changing. Things are changing constantly, and they will continue to change. So let's accept it and move on. I can look back, but I'm guaranteed to bounce into the wall again. And finally, manage expectations. That's it. That's all I have to share with you. Thank you, and have a good day.